This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about partial thickness rotator cuff tears on an MRI. What do they mean? If you like this video, we put out new content weekly, so please like and subscribe. So, the rotator cuff muscles, they're not really the prime movers of your arm, that's the deltoid. The rotator cuff muscles just kind of keep the shoulder in place. So it's a ball and socket joint, but the hip is like a real ball and socket joint with like a lot of coverage. The shoulder is more like a golf ball and a golf tee. So there's these small muscles called the rotator cuff muscles, and they keep everything centered. Without them, you have pain, and then the head of your humerus starts to kind of move upwards. But anyways, so a lot of times somebody will have shoulder pain, they'll go see their ortho doc or maybe their primary care doc, and they get an MRI, and it shows some partial thickness tears of, let's say, the supraspinatus and infraspinatus, which are the rotator cuff tendons most commonly torn. And the question is, what do they really mean? So obviously, partial thickness tear, it means it's not torn all the way through. So when you have a full thickness tear, it means that the whole tendon is torn, and sometimes you'll have a retraction, meaning that the tendon is pulled backwards. That's not the case in partial thickness tears. It means the rotator cuff is still intact. You can have it on either side. You can have it on the top side, which they call bursal, or you can have it on the bottom side, which they call articular. But with any MRI, they need to be taken in context. If you get an MRI of anyone's shoulder, and if they're older, even if they don't have pain, you're probably going to find some tendinosis, which means thickening of the tendon, and some partial thickness tears of the rotator cuff. So there's lots of people walking around with these partial thickness tears and don't even know it. So the question is, you may have had shoulder pain and gotten an MRI and it showed that, and then what does it really mean? So on an MRI, you can find a lot of things that are not always important. So that may very well be your pain generator, but it might not be. I mean, you can have biceps tendonitis, that doesn't show up on an MRI. Shoulder impingement doesn't always show up on an MRI. It could be from arthritis, could be from HC joint arthritis, could be like a partial thickness labral tear. You know, there's lots of things. So a lot of people tend to fixate on it, but without a really good shoulder exam and somebody who knows what they're doing, it's hard to tell if that's what your shoulder pain is. Frequently, if you do have a partial thickness tear and it is symptomatic, most of the time it can get better with physical therapy and an injection. That'll sort of calm things down. And then if it doesn't, what the surgery would be, it would be to cut the tendon and tack it back down. Obviously, you would only do that if you fail other treatments. Some docs will do that if it gets over 50% torn, they'll recommend it, otherwise they might not. A lot of docs are different. But again, the main thing is determining, is that actually the source of your pain or is it something else? If you see a doctor who doesn't really do much with shoulders, they're not going to be able to tell. You got to see someone who treats shoulders regularly, otherwise you'll have no idea whether that's actually symptomatic or not. So again, to sum up, partial thickness tears means the tendon's intact, may not be causing you pain, probably will be able to get better with physical therapy, might not, in which case you might need surgery. So I hope I was able to answer your questions about partial thickness tears of the rotator cuff on MRI. What does it mean? If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you advice about your specific medical vision because this video and all my videos are for educational purposes only. Thanks for watching.